And I want the people of this country to listen to me. When an audit was done on the system of NHIF, a forensic audit was done, 3 million fake people who are accessing NHIF resources were found out. And I'm sure those people and those fake patients, they are watching me now. We know their names. Those facilities and providers, they are watching me. We have their names. Those who use a biometric fingerprints that don't belong to the original person. And if I am pushed to the wall, there are institutions in this country, not the Ministry of Health, that deals with the fraud, independent institutions. We will push their names and we will push their facilities, entities and locations. We must tell the Kenyan people the truth. So 3 million people were found who used the NHIF resources irregularly, illegally, and it became a huge health care fraud, health insurance fraud. And ask yourself a very good question. Why is the mortality rate, women who are dying when giving birth, why is the mortality rate very high in this country? Our neighboring countries are doing better. Because some of the drugs given to those mothers to stop bleeding are not the right drugs. Ask yourself. So there was a lot of fraud in the system. So this digital health system, integrated system, is going to deal with all that. And that's why there is a lot of opposition to the reforms that is taking place in the health sector in our country. And I want to assure the people of Kenya, from the president, universal health care will work. It will work, inshallah, and it will work for the people of Kenya. And it will not work for the elite. It will work for the ordinary citizens. Those of us who are standing on this side, we have a very robust insurance scheme. The elite, for many years, have enjoyed good, robust insurance scheme. Universal health care will give a better health care, access, affordable, quality to the many and millions of Kenyans who cannot afford it. Was Susan Nakumicha a doctor? In the last 20 years, only 2 doctors served at the top leadership of this ministry. Professor Anyang' Nyong'o was the Minister for Medical Service. Beth Mugo was the Minister for Service. My good friend Kagwe was the minister. They were all politicians. So those who are there, they have other agenda. And I have a business to do here. And I don't do it alone. I do with the help of the men and women who work here. I do with the cabinet. I do with the president's advice, because my business is to advise the president. I work with the parliament, which was my home for 16 years. So tell them that the Minister for Infrastructure is not an engineer, he's not a roads engineer. My sister is a medical doctor. She is not a climate and environmental trained person. So those are very pedestrian arguments. I recently got a new name when I talked about SHA, when I was a Minister for Environment. Some people called me bulldozer because of a video making rounds. That was my genuine show of support for Taifa Care, even before the President, William Ruto, deployed me to the Ministry of Health. At that time, I was simply doing what I believe every government leader should do, championing what will make our health system work under the whole government and whole society approach. I will not run away from that name. Please keep on calling me the bulldozer. In fact, let me own it from today. Bulldozers don't build. They clear the way. They remove the obstacles. They make space for progress. And that's exactly what I intend to do here at Afi House. As earlier pronounced by His Excellency the President, effectively to today, 1st April, the ICU and the HDU bed rebate has been enhanced to Kenya shillings 28,000 per day, while oncology package for cancer patients has been enhanced to Kenya shillings 550,000 per person. SHA will settle hospital claims by the 14th of each month. NHIF used to do 6 months and more. So by the 14th of every month, SHA will settle all the hospital claims by the 14th of each month.
Ladies and gentlemen, during my tenure, the ministry tabled key cabinet memos. One of them focused in upgrading the Jaramogi Oginga Odinga Hospital in Kisumu County to a level 6 healthcare facility. While taking care of long-term progress in our healthcare agenda has been a key preoccupation, we have been vigilant in ensuring that disease outbreaks that could compromise our efforts to keep Kenyans safe are in close check. Such outbreaks are Mpox, cholera, Marburg, Ebola from neighboring countries that have had our medical experts on high alert 24/7. Regarding continued funding of our programs in the wake of withdrawal of USAID support, we have considered alternative ways of keeping our healthcare system well-oiled to continue serving our people. The future can only get better. There has been 163% increase in social health insurance membership, with the current registration standing at 21 million, up from 8 million that had registered with the defunct NHIF. The total collection of the Social Health Authority is currently upwards of 31.6 billion. We have so far settled SHA claims to the tune of 24 billion and a further 21 billion under the Primary Healthcare Fund. This has ensured expanded access to social health insurance, with 13 million additional Kenyans covered. Meanwhile, the gazettement of new SHA packages beneficiary will be entitled to enhanced benefit packages that will cater better for cancer treatment and radically improve ICU payment limits.
In slaying them. And then to Madam Barasa, maybe as you're leaving, what is the most important experience that you're taking with you from this place?
Taxpayers' money was lost in the process. Thank you.
Number one,
When the health ministry is really in the eye of a storm, we have various strike threats on the table. We have ongoing strikes by UHC workers. The country is facing...
Yes?
My name is Sheila Chelangat from TV47, and some of the doctors, even those that are outside, are skeptical of you being at the helm of this docket. Argue
wait for PSS. How can we wait for my PSS?
I thought you were coming down.